We are live. Hello, humans. Happy Monday. Dr. Sarah Happening here with Performance is Happening. And today we are continuing our Total Worker Health Symposium speaker interview series. And today we have with us Bob Gold. So I'm going to welcome Bob. Thank you so much for being here with us today.
Oh, thank you for having me. I'm excited to participate.
Yes. So we are in the week of the symposium. It is all going down this week. So hopefully you're registered and you can catch our sessions that we'll be talking about. I'm going to introduce you to Bob. So joining us today is Bob Gold, CEO and Chief Behavioral Technologist at GoMo Health. Bob is one of the world's leading behavioral technologists with more than 2 decades of applied research in human motivation, activation, and resilience. His work has shaped digital healthcare programs that support millions of people every day across chronic and complex health journeys. Sounds so exciting. Thank you again for being here, Bob.
Thank you. I'm learning from you on motivation.
Yes, we're both passionate about helping the humans do the hard things. But at the end of the day, we can only help ourselves, right? We can lead a horse to water, but you can't necessarily help them past that.
That's mostly true.
Yes. Okay, Bob. So you've dedicated your career to understanding human behavior and improving well-being at scale. For those of us who may not know you yet, can you share a bit about your journey and what led you to create GoMo Health?
Well, it's sort of a fascinating journey, but the short story is I created GoMo Health about a little under 10 years ago. I knew nothing, so to speak, about healthcare. So my world started on Wall Street, where people were not understanding financial data, and all the dimensions and what to do and how to absorb it. So kind of developed the science to get people to understand end dimensions of data and how to absorb it, how to motivate people, activate them to take smart action. So then what happened with that, did that for the security industry, and then did that for the NASA astronauts. They have 180 knobs on the shuttle and how their hand-eye works and how do they absorb it. Then I did it a little bit for Marine pilots. I can't say what that was, but basically, if you're told to do something that involves damage in the end, do you wait? Do you do it? How are you motivated? How do you deal with it afterwards? What's the reaction? And then after a while, I saw living life. We all have healthcare things. My sister-in-law died of a young age of lymphoma, cancer, and I just saw how healthcare worked, and most of it had no understanding of how humans operate, and what they do and how to help them. And I said, I have this science and we know how to digitize it. So we formed GoMo. So we take all these scientific evidence-based science we developed that are clinically vetted, and we put it in a digital format to engage people mostly through text messaging to motivate, activate, and develop and foster resiliency. And that's sort of the story.
I love that. I love that because I heard you say 2 things, basically, like you're taking the science of data and then applying it to real life. And as humans, I mean, we're not all robots yet, right? But how you work in one area of your life, a lot of that is life transferable skills. So,
yeah. What's interesting when you mention we're not all robots yet. So we just launching a new program. So this is interesting. One of the, we live in a mental health pandemic, the whole world anyway, right? So especially employers, but we noticed that large, especially medium or large employers, in implementing or trying to implement AI in the last year or so, has increased workforce stress. Because what's happened is it's kind of a fascinating motivation resiliency issue. So what happens is executives say, we got to use AI here. Okay, AI, and the departments don't know exactly what the governance is, what the rules. Am I replacing myself? What's my future job description? Where is this going to end up being? Like, am I valuable anymore? So we now offer a program to employers, not around how to implement AI, but how this is added to the mental health and how do you build psychological safety in times of transformation. It's fascinating information about how it shapes outlook of employees and the associated behaviors on that.
Yeah, for sure. I think, yeah, AI is a scary thing especially for those that aren't. I've been training my AI model since 2023. So I feel like I have a good understanding of how it works, but I see how it can be very terrifying, as you said, if you have someone who thinks that they're training their replacement. But there's a lot of really amazing things, especially because I deal with neurodiversity a lot, even just with decision fatigue and how you can just word vomit all your stuff to the AI and say, help me prioritize, because our brains aren't good at prioritizing. But it is scary. And I think it's really important for humans to embrace the AI because it's happening anyways, and then how to work with it and not against it. And I think humanism and being human is going to be very, very valuable, but it is scary for sure.
Yeah. And, in what I do, part of my background from a science perspective is the intersection of kind of how the brain works and how machines learn. So that's what my area of expertise is. And to your point, how do you train a machine? How does a machine learn? And how does human brain learn? And what are those similarities and differences? And so it's not going away, to your point. And how do you use it is critical. So it's not necessarily the functionality. It's just the effect of psychological safety in the mind of people.
Yeah, for sure. And I love that everybody who I've been interviewing as part of this series, I love how we're all talking about psychological safety or psychosocial perspectives, and it's not just physically safe as far as the workplace goes. I love that finally we're looking at humans as humans, meeting them where they're at, but also from the organization, going top down and bottom up, and we're still humans and they need to be supported at work. So when they take them home, you're human. So when you leave your workplace, you still have all that coming home with you. But I think that's a really good transition because your title is Chief Behavioral Technologist. And that's super unique. I've never heard anyone with that title before. So what does that mean in practice? And then what is the role of a behavioral technologist? And how does it translate into real world health outcomes?
Wow. So, it is a unique title. So anyway, the idea of a behavioral technologist is sort of, in today's day and age, it is in vogue. I've been doing it for a long time. So really it's understanding of the brain, the associated behaviors that happen based on what's going on in the brain, and how do you transform that into technology programs that motivate, activate, and create resiliency. So it's sort of that's what that means, behavioral technology. So it's not just building an app about anxiety or about your child who has autism. It's about understanding what's going on and the effect of things and asking questions, learning about people. So how do you learn about people through digital means? And what questions do you ask? How do you react to the answers? And can you personalize experience for people that makes sense? So, for example, we have almost 10 million people a day we engage around the world. No one's getting the same messages, even if they look similar on a clinical diagnosis, because, based on your age, gender, you have issues at home, work, and play. And, today you could be better. Tomorrow, your kid could be in a car accident. You have anxiety. And how do you react to all those things? So that's what we kind of help figure out over the years, how to ebb and flow with people along the way. And we're with them 24/7. So a human if someone's freaking out at midnight on a Saturday, they're not going to engage a human per se, but they can engage GoMo. That's the idea.
Yeah. I love that. It sounds like you're doing what I do, but like on such a bigger scale and using technology, which is awesome. Like, as you said, in the midnight, and someone's going through some sort of crisis or situation, then they can engage GoMo and,
Yeah. So we have hundreds of provider type of organizations that use GoMo in conjunction with the treatment plan, that engages them to be supportive and reinforce it in their lived environment. One of the fascinating things I noticed, because I'm only 10 years into healthcare, I said, it makes no sense how clinicians are taught to deliver. It doesn't work like any other industries. For example, if you're going to learn to play the piano or a sport, and let's just take the piano. So they come to your house or you go to them and they sit for half an hour or 15 minutes and they give you stuff. And they say, Sarah, if you want to make the local town band, you got to practice an hour a day. If you want to make the state, it's 3 hours. If you want to make the Boston Symphony, it's 5 hours of practice, right? So in healthcare, there's one thing to sit in front of a clinician, tell a video in person, hear things, do things, act things out. Then you go home. So how do you practice the principles that are taught in treatment at home? It's fascinating. And then how do you get people to reflect on those things? Because you see, so we have a technique called MILD, micro learning and doing. We give people activities shaped on their experiences and the environment, and then we ask them to reflect on it. What did you learn? Because if you're not practicing, how do you get better? And if I take a case, just a simple case outside of neurodiversity, just to give you an example. Today I learned I'm a type 2 diabetic. Well, how do I practice being a type 2 diabetic? Like, what's the concept of practice? That's fascinating that I saw wasn't in healthcare. So that's what we do, basically. We help people practice the things that you teach them in your treatment. That's why we're used by hundreds of provider organizations, hospital, state, federal organizations to help people practice that reinforces the very things you're trying to get them to do. That's the concept.
No, I love that. I think it's the Ebbinghaus adult forgetting curve. It's like 90% of information within the first 24 hours is lost unless you apply. And it's 90, 70, and then it like completely drops off. But it sounds like you're making it relevant, which is important for motivation, important for humans, relevant to yourself, but also meeting them where they're at. And then 1% better every day, but understanding better about how they can apply it to their life.
Yeah. And there's two things I just want to comment. One is, in general, people are 50% more transparent and honest with us, because it's tough to look someone in the face and say, I can't take it. I'm going to harm myself, or I'm going to come off my med, or I'm going to do whatever. But so we typically collect over 50 to 100 life factor data points on people at home, work, and play in their environment longitudinally. We've had clinicians change their whole treatment plan based on the data we're able to provide. It's been fascinating because, oh, wow, this is what happens and all this stuff. So, so that's number one. And number two is we've been able to discover things that have never been discovered before because of what we do. So, for example, we are the digital care management for the drug court treatment program in Montana. So we see discharged prisoners, people picked up by police, all types of mental substance issues, comorbidities. And we discovered within 6 months of running the program that if you have children aged 7 to 17, you have 3 times more relapse and rearrest for substance use because of the stigma associated with it. So what we did is, they've been running this for 50 years. They never figured that out. So we figured it out, and then we added more parenting tracks. we have a whole program where we communicate to family members, which is sometimes as or more important than the person served. So, and then we see the dissonance between if we're asking a family member what the experience is and we're asking the person and we're seeing some differences. It's fascinating what you do with that data. So, the whole idea is how do you get better informed to adjust whatever it is that the person wants? And that's how we help more of the traditional treatment plans get more effective.
Yeah. And it sounds like you're collecting a lot of data beyond just what you would think in a well-being practice that you would want to collect, like a 360 approach of everything that's going on.
Yeah. And also, it's interesting, like if you just take any socioeconomic person just across the board in the US, 30% of men don't really go to a doctor unless they are forced, 20% of women. And then by ethnicity and all types of stuff that varies, higher or lower. But part of what we do is help people realize that maybe they can get help and build their confidence because they're interacting. We're anonymous. We're confidential. So when we do, let's say, military work for guys with PTSD, or we do various mental issues for first responders, police, firefighter, EMT, a lot of those guys don't want to admit anything. And they're afraid to admit because maybe I'll get taken off the force or discharged but what we do is it takes a while, but we try to build them up where they're gain confidence to raise their hand, say, you know what, I'll go for help. But that doesn't happen right away. So part of it is, yes, part of it is augmentation to treatment like the ones you provide in your stuff. And part of it is, let's say we're doing a workforce, getting certain people who are not getting help and they should to willing to come forward because we've nurtured them for 6 months in a way that it's build their own self-trust and own self-confidence, their own believability that it's okay to raise your hand, right? And, for men, that's probably a little harder than women, but in both cases, it applies.
Yeah, I love that. And I think it's so important. I was going to ask if it was anonymous data, and I think that makes such a big difference because of the stigma around mental health and getting help and going to the doctor and all this garbage that exists. But it is also, for a lot of people, they don't get the help they need until something really big happens, something goes wrong, or they are really sick, or someone close to them passed away from something, and they realize that it's time to take care of your health. There's no such thing as like too late, like now and moving forward, I think is the best. But I think that that's great that you can build trust over a period of time. And then it's anonymous and you can collect data, and then I'm sure give them support for what they need depending on the data.
Yeah. And one thing I learned way back, even before healthcare, that carries over to me, like they say in real estate, the top 3 things are location, location, location. In health, it's outlook, outlook, and outlook. So, and then when I started in healthcare, I said, no one asked anyone their general outlook over the next few years. So, and I found that fascinating. So, for example, if Bob Gold has these issues, I have ADHD, whatever I have, right? And I say my outlook over the next, on a 1 to 5, forget health, forget ADHD, just my outlook is like a 2 or 1. 5 is good, 1 or 2 is bad. And you say, Sarah, it's a 4. I got this issue, but I'm going to get through it. You can't engage those people the same way. It makes no sense. Like there's certain things you got to do with Bob Gold to build some self-trust and self-credibility to get him even willing to listen. Mm-hmm. There's a lot of good content out there. There's a lot of smart people who can help. But if the person, first of all, is not willing to listen, you got to get them over the hump. The second thing is that I noticed too, there's not as much attention to, in this case, if I'm the patient, Bob Gold, do I feel I can do the things the clinician is telling me? So it doesn't, if I don't believe that, like I'll sit there, yes, the clinician, and I'll go home like, hey, there's no way, that's not from, I can't do it. Like, so I don't do it. So what's the concept? What we work on is those two concepts. One is, how do we get someone willing to even listen? And then how do we build their self-trust, self-credibility, which we define as self-believability, that alters their outlook, that gets them more activated in their own self-care, right? So that's sort of the principles involved. We have these algorithms that we've used over the years, these different technologies, all based on cognitive behavioral science principles. Mm-hmm. That's how we do it. It's fascinating.
I think that is fascinating. I think that's awesome. What would you say since you get to collect so much data, what is the most surprising on your end from the data collection standpoint that maybe you would say, if you were to go into an organization and start tackling one thing, does your data show, I would guess mental health, but is there one thing that you would prioritize in most organizations?
Well, see, I've been at this so long, the most surprising thing to me, and I think this is about employers and employee wellness, right? This particular talk for the most part. Mm-hmm. Executives need to understand the cognitive issues and the associated behaviors when they do things. So they have all this wellness stuff. Oh, we'll give you a free gym membership, this, that. It doesn't work. It's stupid, actually. They have an app for this, an app for that. Meanwhile, people got 8 issues. What am I going to have? 8 apps? And, it's just, in fact, it helps people shrink. It's just cognitive overload. So the first thing is that we try to do is educate executives into understanding what these people, or HR execs, understanding really the cognitive behavioral issues that may cause absenteeism, retention, focus, motivation, and then what's the behavioral economics between your gross revenue, your gross margin, your net income, and people's mental state and focus, right? So there's clearly, I'm working on a small US committee to actually quantify economically brain health for employers. Like, it's fascinating work. We're not there yet, but we're working on it. So I would say my biggest message to your question, what I've been, realize is people really who are making decisions about, quote, wellness or this or that, don't really truly understand the science of human motivation, activation, resiliency. And that's what we have to train people on.
Yeah.
That's what I would say.
Yeah. And it is challenging. I mean, people like you and me, we know that when a whole human is supported, then that's a good business case to see an ROI for whatever the business outcomes are for that organization. But it is challenging to put numbers behind all of it, to say, when they're supported at work in their brain and body, like productivity, retention, happiness, all these things, it all goes up. But it is challenging to, have the data behind it.
Yeah. And because it's such sort of a pandemic, it's getting a little less challenging in the sense that if you look at certain fields, first of all, the fastest growing reason for going on workman's comp in the United States of America is mental health, actually. Not the largest raw number, but the fastest growing. And if you look at a field like nursing, it's astronomically growing. People saying, hey, I need time off for my mental health. So that makes it a little bit more easy for executives to understand, well, maybe I need to address this, because putting people on workman's comp and then paying for all that economically is a lot of money. Plus, I lose them in the workforce, right? And so we're starting to work with some workman's comp organizations and others to see, because they're mostly addressing occupational health hazards. Oh, my back, I fell. And those are important, but, they're not addressing the brain. Yeah. So that's what I think is sort of where we're at now. It's becoming more okay to talk about it and deal with it than it's ever been.
Yeah, I agree. I mean, if you have a broken arm, you're going to talk about it at work and say, I got to get my broken arm fixed. But when you're experiencing stress and burnout and anxiety and overwhelm and whatever it is, it's just not as acceptable. But I think the more we talk about it, then we can reduce the stigma. At least that's my goal.
Yeah. And, one of the interesting things is certain people, maybe since birth, but let's just talk about adulthood, they're let's say there's low grade stress for years. Now, certain types of, let's say, stress, not high stress, is good. I mean, it's motivational. If I have a big podcast I'm doing and maybe I get a little stressed, or, I'm doing a talk, like some of that's good. I want to compete, but some people may not even realize the effect on themselves because they live it every day. It's very interesting. Like you may meet someone and thinking, oh, this person needs help. And they're thinking like, why? Like they're so used to it, So the way you ask questions, the way you put them in scenario, the way you get them to practice something over time helps them think, maybe my life could be a little better. It's interesting. I mean, in some cases, it's obvious to the person. Fascinatingly, in some cases, what's obvious to others looking at them is not obvious to them. So what we try to do is get people to realize that, because otherwise you're not going to seek help if you don't believe you need it.
Yeah. And I mean, the human body and brain is phenomenal. Like it adapts to whatever level of stress you're putting on it. And then you get a text message and you don't know you're getting the same physiological response as if a tiger's chasing you, but you just heard the beep from your phone. And that like elevates your cortisol a little. And like, if we don't ever take any time to bring it down, then you wonder why you have like an autoimmune disease or you're sick all the time or,
Right.
I think that's important to be able to bring that awareness to the person. Okay. Holy, time flies when you're having fun. I have a question specifically. So you have a concept called behavioral RX. Can you explain what that is and how it supports workforce resilience?
Yeah. So in general, that's what we've been talking about. So the science of engagement that we use, we've trademarked, and it's called behavioral RX. In other words, it's a medicine for the mind, to speak. So that's kind of the idea, of it. And what it is, it engages people digitally a lot through text messaging, and it asks questions, it learns about people, and then shapes the engagement. So to take a simple case, if someone indicates in our thing that right now I'm having trouble sleeping, let's say, we have a way of asking if that's acute or chronic. We don't ask it like that. And then we say, oh, Sarah, what time do you go to sleep? Oh, I go to sleep around 11 at night. Okay, great. At 9, we'll start to send you stuff. And you're like, but specific to you, whether it's music, meditation, affirmations. And you're like, this is great. It's not another stupid healthcare survey that I don't see how it's like they say something and our system reacts. Like, wow, so they're more likely to be reciprocal because we're showing reciprocity first. And then, so for example, if we're doing, there's certain foods and nutritions that either could be calming or make you a little hyper, or other things. So depending on, or I'm maybe a vegetarian or whatever, we personalize, or I have a diabetic. But so then we ask you, when do you do shopping? Okay, so, Joanne says weekly. What day? Sunday. Okay, you know what, Joanne? We're going to send you vetted recipes Sunday morning of ingredients you can buy in the supermarket. Like, not go to no one's in aisle 3 shopping. Oh, let me go to an app and pull up. It's like, but if you deliver it to them in the moment, they're more likely to do it. So that's to give you a little color of what behavioral RX does. So it learns, it listens, learns, and responds to people. And then people could triage it if they're experiencing something like high level of stress, anxiety. They just text one word and the system goes into triage mode. And then it also, based on the rules with the provider, it could escalate to a care manager, care coordinator, pharmacist, doctor, nurse, behavioral counselor. So depending on time of day of week, those types of things.
That's so amazing. That's amazing. That sounds like such a great. That's especially that you can do that at scale. I think that's so cool, because meeting humans where they are at, that's the best way to have an effect on their motivation for sure.
Yeah. And we're all about, it's interesting. Like, this is kind of my give back for the world. Even though we're not a nonprofit, I think we help a lot more people around the world than most nonprofits. And we're about doing it at scale, right? Like, so that's like, we could be communicating to every employee in 100,000 person employer, and then we can help people through their daily life. And some of them are going to see a clinician of some type, mental, physical, some aren't. But how do you help people in their daily life? So that's we're all about how to do it on scale. Like in Africa, our programs for complex issues are like $1 a month. So we actually save the provider and hospital much more than that in unreimbursable calls, times, avoidable ED visits, all types of things. So, we're working on a program for another country to engage over 20 million people. And that'll be at like 50 cents a month a person, to give you an example. So it's affordable at scale, right?
Yeah.
It's that type of thing. That's what we're about.
Yeah. I love that.
Yeah. And don't get me wrong. We have some behavioral health organizations, like partial day programs, that have 60, 80 people that use GoMo, outside of the partial day, at home, work and play. Right. So you don't have to be large to use GoMo, but that's the idea, that we can scale it as we need.
Yeah. I think that's great. And I really love that you're meeting humans where they're at and giving them, my big thing is 1% better every day, but giving them something that's relevant to their life in that moment. And it might seem like something really small, but for them, that could be the catalyst that changes everything else about their day, their life, their week. So I think that's really important.
And, like, one thing we noticed too over the years is, again, our thing is building their own self-trust and credibility. And one thing is, people with various mental or physical issues, getting them back to meaningful full-time employment actually changes their outlook and feeling of self-worth and confidence. So in our programs, a lot of them, we address like interviewing, or how to get, how to dress, what to say, how to get a promotion, because to your point, it's like a clinician wouldn't think that how you dress on an interview is related to their mental you're not going to sit there in your 15 minutes and talk about a dress code, but we do, because, and that's not for everyone, but if someone's trying to get back, and we see the data, like our data shows tremendous decrease in cost and increase in self-satisfaction when we get people back to meaningful work. It's very interesting. So we're able to look at data in different ways, right? And because we're digital, we're not limited to, hey, I got half an hour with you. I got to get through the basics, because if I don't get through the basics, I can't get to this other stuff, right?
Yeah, for sure.
Yeah, that's the idea.
I love that. Okay, so your session, I have it in front of me. You're going to be part of the Recovery Friendly Workplace Fundamentals. That's going down on the 22nd at 10:45 a.m. We are now on Eastern Standard Time. Do you want to take a few moments to talk about that session and what you hope attendees will come away with?
Yeah, very excited about that session. We probably have more data about people in treatment and recovery at the workplace than anybody, so I'm going to be sharing some of the data. And fascinatingly, our toolkit is used to help companies get certified for recovery-friendly workplace. And we developed the tool by implementing it internally first. So we did it within our company, and we have some fascinating cost data savings from doing it internally from our own healthcare costs as a company, right? So we wanted to be able to translate it into what, let's say, an executive would look at from, okay, here's an ROI if I spend time on this. So we're going to share some of the data and the lessons learned with the audience from an economic perspective and a functional perspective in that session.
I love that. It's such important work. And I know for the neurodiverse crowd, substance use and abuse is like the likelihood is 10 times more likely for neurodiverse population. So I think that's super important.
Yeah, you know, offline we could talk about, so we have a program that we built with Stanford Clinical Excellence Research and US Aging that's right now in California going to scale. So it's caregiver first program, mostly for their older mom and dad, and the focus is on neurodiversity, because if they're starting to have some cognitive impairment as they grow older, and let's say you're doing it for your mom, Sarah, like you don't have a lot of experience on what to do, but you're the family caregiver. And yet you may have your own family. So think about the stress. So we actually have a program with fascinating data about, you know, stress, depression, you know, of caregiver and the neurodiversity of the person they're caring for. We'll share that. It's kind of really cool. And that's going to be an expanding program because in the US, like every country, there's too many people with issues. There's not enough money and clinicians, and everyone's not going to see them anyway. So how do you empower a family caregiver to help better and to help their own life and stress so they could better help a person with neurodiversity in their family? So interesting data.
Yeah. And the holistic perspective, I love that. It's so important. Okay, well, my session, if you guys are registered, is going to be going down on the 23rd at 10:15, and it's called Move at Work Challenge, Driving Employee Happiness and Health. So if you're attending, I would love for you to be at my session. And Bob, thank you so much for spending time with us today. That was awesome. I think what you're doing is phenomenal and so well needed. And the fact that you do it at scale, good job.
Thank you. And thank you. It was great meeting you.
Nice to meet you too. Okay. Hope to see you guys at the symposium.
All right. You got it. Bye-bye.
Bye-bye.